An important benign lesion of neonates. Miliaria results from retention of sweat in the obstructed sweat ducts. First, there is imbibition of water in the ductal epidermal cells of the sweat gland, which lead to swelling of these cells and subsequently obstruction of the duct. So, retrograde pressure causes rupture of the duct and leakage of sweat in the epidermis or the dermis. Now, it most commonly occurs in hot, humid weather, non-air conditioned nurseries, and in infants who are dressed too warmly even in the winter. Two types of miliaria are present in neonates. First is the Miliaria Crystallina and second is the Miliaria Rubra. Now, Miliaria Crystallina is asymptomatic, non-inflammatory, fragile pinpoint clear vesicles which resemble water droplets or dew droplets on the skin. And these are more common on the face and scalp. Now, they usually appear in the first few days of life but may be present at birth. These lesions may suddenly erupt, leaving a brawny desquamation on healing. Histologically, these are intracorneal or subcorneal vesicles in communication with the sweat duct. Now, these can be treated by reducing the ambient temperature and removing the excessive clothing. And if the child is having fever, then antibiotics can be given. Now, differential diagnoses include vesicular or blistering disorders such as herpes simplex infection. Miliaria rubra is also known as heat rash or prickly heat in the neonates. These are erythematous 1 to 3 mm minute papulovesicles with prickly sensation. They are more common after first week of life. They can occur anywhere, but they are more common on forehead, upper trunk, covered surfaces, and flexure areas such as neck, groin, and axillae. The involved skin in severe cases may become macerated and eroded, and the lesion may become infected in malnourished and sick infants. Now, histologically, these lesions are extrafollicular, focal areas of spongiosis or spongiotic vesicle formation in close proximity of the sweat ducts, which contain a keratinous plug. These lesions are also treated by reducing the ambient temperature and by removing the excessive clothing of the baby. And if he is having fever, then antibiotics helps. Now, the differential diagnosis of Miliaria rubra is neonatal acne, Candida staphylococcal or herpes simplex infection.